Hi, this is Dr. Howard Hamat, and today's topic is Barrett's esophagus. Barrett's esophagus is a condition when the cells of the esophagus undergo some changes and start to look more like intestinal cells. And we see this often in patients who have chronic acid reflux, and as a result of the damage from the acid, these changes can occur. The concern about Barrett's esophagus is that further progression in these changes can occur, which can lead to precancerous changes and ultimately even cancer of the esophagus. So Barrett's esophagus is considered a risk factor for esophageal cancer. We often find Barrett's esophagus when we perform endoscopies for patients who have symptoms of acid reflux. When we find Barrett's esophagus, it's very important that we keep the acid reflux under good control, usually with medications. And it's also important to periodically reevaluate the lining of the esophagus by performing endoscopies from time to time and taking samples to make sure the cells aren't changing further. If we do see any progression from normal Barrett's esophagus to any precancerous changes, we can treat that by doing a procedure called an ablation, which effectively burns out the abnormal tissue and can prevent further transformation into cancer. If you have any symptoms of acid reflux, and particularly if they've been of a long-standing nature, and if they're occurring more than a couple times a week, it's important that you get your esophagus evaluated because we can manage Barrett's esophagus and prevent any further damage from occurring to your esophagus. Thank you.